To me.
Perfect. I've done it on my computer. Welcome, everyone. I'm going to start sharing the screen. Give me a moment.
Well, I'm really glad you're doing this one again tonight because I've just had an inquiry about endometriosis.
Thank
So
you.
I
Oh,
said I will
interesting.
tell you all the answers after tonight.
Let's hope so. Okay, so welcome everyone. As requested, we're talking about endometriosis today. And it's not so much that I'm an expert, but I have had experience because I've had endometriosis myself. Just letting in this person here. Invite, yeah, come in. And Bridget is coming in as well. So welcome. My name's Jacqueline Hannum, and as I mentioned before, we do these sessions weekly, and we rotate between Dorothy, myself, and Jeanette. And we talk about health and wellbeing issues, and we're obviously trying to encourage everyone to come along and also contribute to have a little chat, as well as giving information and advice on what we recommend and on the products that we use. We know really work really well to support health, as well as the business opportunity if anybody's interested. So managing my endometriosis and managing the symptoms and the knowledge and so on that I gained just about health and well-being. And so my background is actually in the fashion industry as a garment technologist. And then over the last 10 years, I trained as a yoga teacher, and I've been in the space of health and wellness, offering health and well-being products and doing these kind of presentations for maybe 12, maybe 15 years. I need to double check when I first joined Forever, but it's been a while now. So I'm going to, if you give me a minute, and I am going to do my slideshow. Okay, there you go. There we go. And move on to the next page. So I've got a 30-year journey, but actually it's been much longer than that. It's probably more like 40 years now. And my journey through going through what I've been through. So I was diagnosed with endometriosis and then fibroid. So I had both around 1990, 1982. Um, and it was incredibly painful. I had no idea what I had. It felt very lonely. It wasn't like it is at the moment where there's so much online you can look things up. I just had no idea where to turn. Nobody in my family seemed to have anything like this. And probably I found it difficult to describe and talk about because I didn't really understand why I was having these problems. So I went to my doctor, and he prescribed me medication, which which really did work. And I took it over a 2-year period. And it helped. When I say it really did work, it really helped to ease the pain and the discomfort. And then I took it over 2 years, and then I went back to my doctor to get some more, to get a top up. And he very quickly took it away from me and said, "You're not having those anymore." But he didn't actually give me anything else to support me with the pain and discomfort. And that's when I really realized that I had really needed to make the change myself. I needed to take control of my own health. Um, and at that time, I was getting really involved and interested in my diet, looking at other things that I could do. And these are the two books that I read at the time. At that time in the 80s, that it was almost a bit radical. David Icke himself is a little bit of a radical person at the moment. People think he's a little bit mad, but this particular book was very good. Green Politics Explained. And the other one, Why You Don't Need to Eat Meat. I'm not advocating that anybody stops eating meat, but these are the things I did when I was going through my pain and discomfort. And it really helped me to get a better understanding of what was happening out there, what did I needed to do to look after myself. So it's a bit of an expose of the commercial farming industry, which we all know quite a bit about now, but at the time it wasn't that talked about. Food manage.
Jackie, I want to interrupt just briefly. Tina says, "What medication were you
We're coming
prescribed?"
to that.
All
We're
right,
coming to
okay,
that.
there you go, Tina. She's coming.
Sorry, I didn't see that, but thank you for telling me. We are coming to that. Um, So, food, politics of food and environment. So, let's talk about, first of all, what is endometriosis? So, we know it's an inflammatory condition in which the tissues, similar to the uterus of the lining, the endometrium, which is the cells on the inside of the womb, they start to grow on the outside of the womb. So, you find it on the outside. So, if you look on the right-hand side, you'll see where you see those little blops of red. Let's just let this person in, is where the cells start to grow on the outside. And what actually happens is you'll find it can grow on the ovaries, the fallopian tubes, the lining of the pelvis. It can be found in other areas of the body, but these are the most common areas. And what tends to happen is this is a misplace of the tissue, which reacts when you have your menstrual cycle. So it's connected to your hormones. So when your hormones activate that cycle and you're ready to go through the menstrual cycle, I used to find that I had pain maybe a few days before and then during my menstrual cycle. And it could vary from being quite intense to maybe being mild. But because, please turn your mic off, please, everybody. Um, if we could mute some people. Thank you. Yes. So, as I said, misplaced tissue found on the outside of the womb, and it will react in the same way of when you're going through your menstrual cycle. So, with nowhere to go, it's reacting. It's not there's no flow taking it through the body, but it stays in those areas and can be incredibly painful. So, it's inflammation, and it can cause scarring. It can cause adhesions, and bleeding in those other areas where you're not really expecting it. So, or where it's not normal. So, physical examinations cannot positively diagnose endometriosis, although doctors can maybe feel for nodules and any kind of tenderness and so on, and maybe give you an idea. I'm not sure if maybe a blood test can give you a diagnosis. I'm not sure. Maybe Jeanette could maybe come in on that. I really don't know. But my doctor did it with an examination and came up with possibly endometriosis for me. So, what does it feel like? Severe pain, pillar-like cramps, and it really can be very painful. Painful periods for sure, can be painful with intercourse, bowel movement, and urination can be painful because what's happening is because of these cells that are growing on the outside, they can start to sometimes adhere and make things kind of club together. So all these it means that your organs are not moving freely, can cause infertility, can make it difficult for you to conceive, um, irregular bleeding or maybe heavy bleeding. Sometimes people can feel quite sick with it. So it can be very painful and, of course, cause sub-infertility. And it can be described as maybe aggressive, distressing. You can have kind of stabbing pains, burning pains. It can feel sharp, stinging. Um, so all of these, maybe some of what one could feel if you're going through, just to give you an idea of what it might be if you were going through endometriosis. Um, so cramps during menstruation, we've already talked about, maybe even blood clots. And pain can begin, you can start to feel like it's quite manageable. And then after a time, it can become quite painful and difficult to manage very quickly. So you can imagine that you want anything the doctor's going to give you, you're going to take it, even though you feel like maybe you don't want to, but you really want to get rid of the pain and the discomfort. So, just talking generally about the demands on women, and we know that there are much demands on women today, and these can have maybe some of the impact on some of these conditions that crop up. So, not just endometriosis, lots of things. So having to manage your family, your children, homes, we all know all these things that are quite demanding, but sometimes we don't recognize that they're having an impact on our health. Even though I didn't have children, but obviously I was running a home. I had a very demanding job and I was committed to my job. Poor Mrs. Addison keeps dropping out. And all of these stresses can have an impact on your hormones and can maybe then have an impact on some of these conditions. Diet, lifestyle factors can also play a role. So what we're eating, what we're exposing ourselves to, particularly with younger women, are exposing themselves to so many more chemicals in terms of their nails, what they're putting on their face, eyelashes and glues and all these things build up in your system. And can build up as toxins and make it difficult. They might not be the cause, but they make it difficult for your body to manage some of these inflammatory conditions. So other possible reasons why it could happen could be retrograde menstruation. So I really just stopped using those tampons, which could maybe cause, we don't know as a fact, but it could cause backward flow. These are some theories and some recommendations from doctors. So that could be a problem. So menstrual products. Um, Maybe the layers of the cells surrounding the pelvic organ may change into endometrial cells. This is another possibility. Maybe surgical procedures where afterwards there might be some surgical scarring and abnormalities. I mean, maybe these are rare, but there are also other possibilities of reasons why you could have these conditions. And some of the treatments are coming to whoever asked the question about the treatments. So I was given danazol, and as I said, it was effective. It didn't resolve the problem completely, but I did get some pain relief. But I didn't know it was a steroid, and that's why my doctor took it away from me so quickly and didn't allow me to top up after I'd been taking it for 2 years. I probably had been taking it for too long. But again, I was left with nothing else to support me. So that's why I had some radical changes in my life. But there are other things, and now we know there are lots of other supports out there. Um, these the hormone therapy, synthetic hormone therapies, pain relief. The contraceptive pill is supposed to be able to help fertility treatment, suppression of the ovaries to reduce the estrogen buildup. We know that a lot of this is related to estrogen imbalance. So balancing the estrogens in every way, surgical treatments, which like laparoscopy, which really is an investigation to look and have a look. So I did have one of those in the early stages. But also at the same time, they can do a little bit of cleaning to remove some of what's there, and that can help to relieve some of the discomfort. To the extreme cases, you might have hysterectomy or removal of ovaries. But of course, you would discuss these with your doctor and discuss what you feel would be appropriate. But I would obviously look at the natural therapies as much as you can to start with. So acupuncture is something I went for, but it didn't work for me. I haven't tried it recently, but that was like maybe 30, 40 years ago. And I found it just far too uncomfortable. And it may be that I was just holding so much tension in my body that it didn't work. But I do know some people who have tried acupuncture and it has worked for them. Herbal supplements, sort of herbal teas, and supplements. We'll talk about recommendations for supplements in a minute, but they can help because we know again it's an inflammatory condition and it's around and hormones as well, and balancing your hormones. Dietary and lifestyle changes to help reduce inflammation. So what you're consuming, what you're putting on your body. Where you're going, what you're doing with your life can be really important. Body massage to release tension. It's not going to help with the symptom itself, but it's going to help release tension in your body. What I recognize a lot is that I was holding so much tension because of the pain all around my digestive system and around my womb. And it's only when I started to do things like yoga, meditation, relaxation that I started to get some kind of release from the pain. So I worked on how to reduce or to manage estrogen levels, maybe bringing up the progesterone, because sometimes it's about best progesterone, which are the two hormones, estrogen and progesterone, the main hormones for women. Maybe that's completely out of balance. So it's finding a way to bring those out to balance. There are increasing your natural progesterone. So there are progesterone creams you can buy on the market out there, but it's also worth going to talk to a specialist and making sure you get the right one and you're using it in the right way. Lifestyle, particularly a circadian rhythm, making sure you get to bed so you can rest and that your body can recover and do the work that it needs to do. So lack of sleep quality and rest can be really an impact. And overexposure in terms of environmental chemicals and synthetic estrogens, that's a big one. Synthetic estrogens can come in the form of plastics that we put on our food. We know plastic bottles. There's lots of talk out there now about microplastics in the bottled water that we drink. So the bottled water that we buy that's plastic, we're finding that there are microplastics in the water. So this is another way in which we're getting these synthetic estrogens in our body, and they're disrupting the normal estrogens and causing problems in our system. I highly recommend this book. It's a book that I read, or certainly looked at and referred to, about endometriosis and also balancing your hormones, the estrogen dominance. So it talks a lot about estrogen dominance and where it's coming from. We also know that because of the pill that most of women, a lot of women are taking, not most, but a lot of women are taking, we urinate out the some of the estrogen into the water, and it gets into the water table, and then somehow it's coming back into our water system. Sounds a bit gross, but this is apparently what's happening. So there are all these ways in which we're being exposed to synthetic estrogens. So that's a book that I would highly recommend if anyone's really interested. So taking a deep dive, I can't go back, but taking a deep dive into what I needed to do to help manage my condition, but also maybe it's something, if you're looking at this for yourself or for a family member, it might be something you can take some recommendations away here from. So does anybody have anything they want to add or contribute to that? Maybe you know anyone or you have the condition yourself. I'm
Hi,
quite like
Jackie.
to hear. Hi,
It's
Helen.
Helen.
Thank you so
I'll
much.
jump in.
Yeah.
I have endometriosis, and I
Mm,
so 7 years ago now, I had a laparoscopy, like a treatment laparoscopy. Really, they knew I had it because I'd had an MRI. I had cysts on my ovaries, which turned out to be multiple endometriomas. But
right.
I had an MRI because they were ruling out ovarian cancer, and
Uh-huh.
they um so they knew that it was likely to be endometriosis. But yeah, really long 4 hour operation. So just going on
Wow.
what you were saying, it was had a huge pocket between my rectum and the back of my cervix. It was stuck to my bladder. Had
Stuff. Yeah.
yeah, big clusters of endometriomas on my left ovary. So it took a long time.
Mm,
Then I had my children. Actually, if you're successful in being pregnant, it's quite common that it all settles down in that period
yeah.
where all your hormones are changing and you have your
Yeah.
children. It's only
Yeah.
really been in the last year, look, not sleeping, clearly. This is one of my daughters. Um, and so it's been in the last year really that I've got a slight return of symptoms, but nothing in comparison to, I could wake up in the middle of the night with extreme
Yeah.
pain and be
Pain.
rolling around. So it's not back to that degree, but
Mhm.
I'm definitely at a stage where I very much know I can make a lot of improvements in my diet and the way I'm looking after myself. So
Yeah,
yeah, I
for
guess that's
sure.
where I'm going next. I do have an IUD in, so I'll get progesterone in that way, and that manages no, and that certainly manages symptoms as well for me. So, but it's
Can you
not for
say that
everybody.
again? Sorry, you do
So,
have a what? An IUD?
an intrauterine device, so a coil with
Oh, right.
progesterone in
Sorry.
it.
Yeah. Okay.
Yeah,
Oh, right.
sorry,
With
I'm
progesterone in it.
yeah.
Yeah. Perfect. Yeah.
So yeah, and that manages my symptoms.
Fantastic.
Yeah, at the
No, thank you
moment.
for
Yeah.
sharing. Appreciate that. It's really nice to hear from other people who've experienced it and know what it feels like. Sorry, Dorothy. Yeah.
And Helen, I'm curious, when you drink the aloe, does it help the symptoms? Have you drunk it through a menstrual cycle?
Yeah, I guess I mean my periods are very, very light because of the coil anyway.
Oh,
Um
I thought the
it
coil made periods heavy.
the copper coil can, but if you've got a coil with progesterone in it, it tends to make them lighter
Oh, right.
or they can stop altogether, but mine don't tend to stop, but they're much lighter. Um I think just generally drinking the aloe does generally reduce aches and pains. It's interesting. I've never really thought of the fact that are my symptoms less severe now because I'm now drinking the aloe? I hadn't really given it much thought, but obviously I wasn't before.
Mm.
So, and
It's
then
interesting
yeah,
because my daughters, and it's not to do with endometriosis, had very painful, heavy periods. And 3 cycles into drinking the aloe, the periods were light and not painful. And Nyasha will tell you that about herself as well,
yeah.
that her
Oh,
Mm.
periods were
interesting.
different.
So,
Hmm.
in answer to the question that just popped up in the chat, I haven't got either of those. It's a Kylena. So it's not a Marina. A Kylena is similar to a Marina, but it's got a lesser amount of progesterone in.
Right.
So,
Right.
um,
Right.
but yeah, I mean, I obviously 2017 I had my surgery, and then 2018 I had my first child, breastfed for 10 months. Then I had my second child within like the next, I was pregnant again within sort of 4 or 5 months. And then breastfed her for like 2.5 years. So I'm probably only really in the last, 6 to 8 months really been in a stage where my kind of hormone levels are settling back down to what they
Yeah.
are when you're not pregnant and you're not breastfeeding.
Yeah,
So,
yeah, yeah.
um,
Fantastic. Thank you.
Um,
And thank
and
you, Dorothy, for that.
Jackie, our lovely new Fiona is asking, what about the moon cup? And she asked that question at the point that you were talking about backflow and not using tampons.
Right.
She asked the question, what about the moon cup?
Yes, I'm not sure. Because I haven't tried it myself, so I wouldn't know. And I haven't heard anything that that is a problem. Um, but it's just to be mindful that anything that maybe stops the flow in that way, in a natural way, may cause it. It is a theory. And of course, if you've got endometriosis, then you just want to be mindful of anything that you might be stopping that natural flow. That's what I would say.
Well, my answer to that was I don't think about it's the moon cup because the moon cup allows natural flow of blood out of the uterus, just catches it,
Mm-hmm.
and then
Hmm.
you empty it, and then you pop in
Hmm.
another moon cup.
Yeah.
So it's different from a tampon that
The,
just sort of plugs
yeah.
the gap.
The other thing is that because I found it uncomfortable and painful using the tampon. So I don't know how far the moon cup goes. So again, if it doesn't feel uncomfortable, then yeah,
Yeah.
that's what
Mooncap
I would.
is very good, but
Mm.
it has been associated with increase of bacterial infection.
Mm.
So when people has endometriosis, that they use the mooncap, in some people can cause a small cramps pain, in others could be very good. But
Mm.
what they have been associated is with a lot increase of bacterial infection in the area.
Fiction. Interesting. Interesting. Thank you,
Mm.
Jeanette. Yeah.
And
Mm.
Fiona, you're welcome to unmute yourself. She says different sizes, and it depends how people use it. It's revolutionary, and I
Mm.
agree. I think it is
Yeah.
revolutionary, the moon cup.
Hmm.
Yeah,
Hmm.
but
Fabulous.
it might be different. Um, if you have a situation like endometriosis.
Yeah. Yeah. I think it really does depend on the individual because I remember just feeling that anything would be very uncomfortable, particularly when you're going through your cycle.
Hmm.
So, yeah. So, yeah, thanks for sharing. Going back to changes. So, just really looking at food and making I change my diet changed overnight, really. Those two books that I showed you at the beginning of the slide were the two books I read, and within a day or two I just stopped eating meat. I stopped having most dairy, although I did continue to have a bit of dairy and then stopped that later on. My diet was plant-based with a little bit of fish. And that changed on and off as you went along. I really increased my activity because I remember reading lots around the importance of physical activity and how it releases endorphins and all those other hormones. And we know, everybody knows how important it is. But I really did take it up to 11, really working out a lot. And so it helped me manage the pain. That's what helped me really manage the pain. And I did feel a huge difference when I stopped eating meat and so much of the dairy. And even though I didn't consume milk and so much anyway, and cream, but cheese, which can be quite dense. Um, and I was probably eating those commercial cheeses, and we know now that a lot of them just, come from farms where they have so many chemicals, and they're giving so much to the animals that we're then consuming ourselves. So when I stopped eating those things, I had felt just a huge difference in my well-being as well as managing the pain. It didn't get rid of everything, but it helped me manage the pain, the discomfort much better, and I felt overall much better. So diet, exercise, losing a bit of weight, also, just recognizing that estrogen is carried in our fat cells. So where you're carrying fat cells on your body, the estrogen there, and again, thinking about that imbalance in your body. So I was very keen to look at that. I'm really thinking about listening to the body. This might be a personal thing, but I think it could apply to all of us. We can, maybe have discomfort sometimes and try and ignore it and move on, but try and listen to our bodies and just bring awareness to where you're feeling discomfort and doing something about it. So whether that taking time out and sit and being present with your body, because I used to realize that instead of fighting it and holding the tension on, if I relaxed and let go a little bit, maybe go and have a bath, have a bit of a massage, those kind of things can really help you until you get through, that stage of discomfort. So overall, all those kinds of things really did help, as well as meditation, doing yoga. I started doing a lot more things like yoga, as well as high intensity exercises. Really improved my overall well-being, and just gave me a real insight into the importance of diet and lifestyle when you have conditions like this. So in terms of food, pretty much most of the things we're always talking about that it's important to have. I've put fiber first, really important to have high fiber foods. And if we're talking about estrogen dominance, but we're also talking about making sure that because you do need estrogen, you do need that hormone, but you want it in the natural form as possible. So making sure you're eating whole foods that don't have a huge amount, but have a small amount, which your body will recognize and know how to deal with. So there's a list here. This is just an example of the kind of foods you should be eating when you want to make sure you get those estrogens balance in your body. Prebiotic, we know the aloe vera is a prebiotics. It's incredibly beneficial. And Dorothy was asking if we noticed the difference in pain or discomfort after drinking the aloe. I think like Helen, I didn't necessarily notice a difference in pain, but I did notice a difference in managing the symptoms, just feeling better. And that overall helps you to manage everything else. So making sure fruits and vegetables is a wide variety. So if you want to look at also making sure that your progesterone is balanced, you want to look at things like wild yams. There are wild yam creams out there you can look at. Again, be careful. Maybe go to an experienced practitioner and talk about, the amounts you should be taking, etc. Because you can use them around the vagina, around your stomach, etc., around your womb, I should say. There are other ways in which you can take them, so you want to get the advice on them. So plant-based foods we've talked about already, giving you lots more examples here, like things like licorice, alfalfa, celery, fennel, tofu, helping to balance those hormones. Good nuts and seeds, soak them when you can. I'm talking about nuts and seeds now because you'll find that they will release the nutrients and you'll be able to absorb them much more efficiently. You'll get the better nutrients out of them once they're soaked. So maybe soaking them overnight, straining them off, and then eating them. If you're going to dry them really quickly and don't leave them too long, otherwise they will go off, they'll go moldy. Cruciferous vegetables really help with detoxification. These are really important, cruciferous and the fiber, really important so that you can move toxins out of your system more efficiently. And I put down again fennel, I've already mentioned, but it's a really good as a substance for helping with those hormone balancing. And things that we need to reduce, minimize as much as we can. For me, it was animal-based products. That's what works for me. You can, look at what needs to do for you. And dairy, we know there's lots of information out there saying that they are inflammatory and they can have an impact on your hormones. So even if it's for a short period, maybe just to look at your diet and maybe see what works, play around with different foods, maybe an elimination diet and see what works for you. You'd be surprised the impact it can have. Alcohol consumption, I drank very little anyway. And over the years now, I just almost don't drink because just don't feel good when I drink. Ultra processed foods, again, we're always talking about sugars, biscuits, cakes, pastries, just keeping them to an absolute minimum. We've talked about dairy already, pesticides, mercury, preservatives, fry foods, these things are either in our environment, which is difficult to control, but the things you can control, the things that you consume, areas that you're in, just bringing your awareness to this all the time. And I just wanted to mention nightshades because we talk about this in yoga, and nightshades as sometimes being inflammatory foods. I don't find it a problem for myself, but some people do say that they find it that maybe they have flare-ups sometimes if they're eating these kinds of foods. So just bringing your awareness to those and maybe just keeping them to a minimum. So these are what we would recommend for endometriosis. And I found Forever HA to be incredibly beneficial, not just for the inflammation, but also for other things like my skin. My skin much better. I always see a difference in my nails. And it's great because it has, for HA is hyaluronic acid, which is a substance compound that's naturally occurring in our bodies, and we gradually lose it a bit as we get older. Um, that's what this supplement is, and Forever have mixed it with ginger and turmeric oil, which we know they are anti-inflammatory. And I think it's curcumin that's actually in this supplement. So it's not just the turmeric, it's the active ingredient that's in this supplement. So it's a really powerful anti-inflammatory that has so many other benefits. So it can be really good for lots of reasons, not just endometriosis. And then Forever Multi-Maca, which is great, this because it's mixed with L-arginine, and we know L-arginine, well, why won't it come up? There you go. Is really good because it's the ingredients in L-arginine, which is nitric acid, just went out of my mind for a minute, which helps to relax blood vessels and allows the blood to flow naturally. So this is good for energy. This is going to be good for energy. I love this multi-matter. If I'm taking it, it's incredibly good. And when you're going through symptoms like this, you can find that your energy is draining. So this is a great thing to be taking. But it's not just for, and again, not just for endometriosis. I take it if I want a boost of energy. It's good for women who wants to help balance their hormones. Incredibly beneficial for women. It's been around for thousands of years, and we know that the Incas used to use it. Men used to use it when they were going to war. Women used to use it for strength and stamina. So it's incredibly beneficial supplement to be taking. And here we've got our Forever Daily. A multivitamin is going to be great, just because, again, you're going to need to support your immune system, and make sure you've got all the vitamins and minerals that you need in a small amount to make sure that you're going to get everything that you need. And it's going to help boost your immunity, fight off any pathogens. If you're feeling down, this is going to be a great thing to be taken just for overall health. And in Forever B12, Jennifer always recommends this, particularly for women, because it's going to be very good for your menstrual cycles, menstrual cramps, for your mood. I used to find when I was going through endometriosis problems, it really did affect your mood because, you're in so much pain and discomfort, or can be. Not everyone is the same. But I found I was in so much pain, it was good to have something that would boost my mood. So taking something like this is going to be really beneficial. Vitamin B12. And then moving on to our famous aloe vera. And as we were talking earlier, Dorothy mentioned about the aloe vera, whether you feel any different in terms of pain. But I know that I just felt more energetic. I felt more, as overall well-being felt better. And so that's why I drink it. I also know that when you're drinking aloe vera, it helps you absorb other nutrients and other vitamins more efficiently. So we know up to around 30% when you're drinking aloe vera, it helps you absorb those things much more efficiently. So there are so many great reasons for drinking it on a regular basis. Aloe vera is a probiotic, so it's very good for feeding your guts and making it really healthy. It feeds it's a prebiotic. I've put pro there. It's actually a prebiotic, and it feeds your probiotic. Um, it's anti-inflammatory. It has ingredients that are anti-inflammatory. It also has vitamin B12. I mean, when I came across this, I met Dorothy at a store when she was selling the aloe, and I knew that aloe vera was very good for you. And I know my mother used to take it, and they used to grow it in Jamaica, but I didn't really understand the science and the benefits. And I also knew that B vitamin's very difficult to get for people who don't eat meat. So it's very difficult to get maybe sufficient amounts. When I was talking to Dorothy on the stall, she said, "Oh yeah, you can get a small amount of B vitamins," and that got me. It's like, yep, that's it. I'm going to be drinking this aloe vera. So as well as all the other benefits, making sure that you get your top up on. It's a small amount, but it's a top up on B12 from your aloe vera. And we know, as we've mentioned many times before, it's so good for cleansing your digestive system, keeping everything smooth. And as we know, so much information out there now that having good digestive health can support you on so many other levels. So it's such an important thing to have good digestive health. Supports your immunity, so it can be quite draining when you have this condition. So it can support your immunity, and this is due to the long chain sugars, the polyunsaccharides. So just to recap on the things that we've recommended, and making sure that you look after your body because it's the only place you have to live. So the multi-maca you don't have to necessarily take all these things at once, but these are things that are going to be very good. I would always recommend the aloe vera gel and then another supplement depending on what you're going through at any one time. The Forever HA, very good for inflammation. Your Forever Daily, which is your multi-vitamin, very good. I take this one. And your B12, which again we know is really important for women, going to be very good for mood and cramps, etc. So I've just pop up here details of whoever might have invited you this evening. The details might be here if you want to contact them and speak to them. We offer a really good service, coaching, mentoring on the business, as well as on the products, which is why, we always recommend that you buy it from somebody that understands the products, use them, has training on the products, and can guide you the best way to use them. So thank you everyone for listening in. Really like to leave it open for anyone else that has anything to share, any feedback. And stop sharing here. Anything else that anyone would like to say? We got somebody
Rosie
that
says, is coconut in yogurt a significant factor when you were talking about diet?
when you say significant, what do you mean as in not to have?
No, that's me. I noticed coconut yogurt specifically was mentioned. So uh, is that
But-
just that the yogurt is good, the coconut is particularly good, that has
Good.
significant, or do they work together, coconut and yogurt?
I'm confused. So, do you mean coconut yogurt? Because I do have
Yeah,
coconut yogurt.
yeah, that
Is
was
that what you mean?
mentioned. That was on
Yeah.
the list.
Oh, right. Yeah. So, if you're not having dairy, then a coconut yogurt is really good. Yeah. And then we know that coconut's really good for you. So, yeah, that's what I would use as an alternative. Is that what you were getting at? Is that what the clarification you
Um,
needed?
no, I thought that, well, I mean, in the fridge there's a coconut yogurt downstairs. But I just, yeah, in endometriosis, has coconut got a significant
Oh,
part to
not
play?
necessarily. No,
Right.
not
So it
necessarily.
could,
No. But
but,
it's probably as an alternative to dairy because it's the dairy that we're trying to put to the side and maybe not quite have quite so much of because it can be inflammatory dairy products.
oh,
Does that
I'm
make
with you.
sense?
I've seen it in a conventional yogurt, you see, so as a flavoring.
Oh,
Right.
I
Okay.
see. No, you can actually get coconut yogurt.
Aha.
Yes, and that's what I have. Yeah. Yes. No, it's good to clarify.
Yeah, we got there then. Not just a flavor. Brilliant.
No,
Got it.
not just the flavor. No, you can get coconut yogurt and it tastes really good. Really good. So,
Oh,
even if you don't want to avoid dairy, but you want to change, there's always those alternatives out there.
that's right.
Waitrose do a really good one.
Mm.
I
Anyone
just
else?
wanted to say thank you so much for doing the talk again, Jackie. It's Helen. Because I missed it the last time.
Yeah, no, thank you so
Yeah,
much for
really, really good.
asking.
And just to echo what you said, that for me, I've always been known, even before I knew I had endometriosis, my family just always knew me as someone that was just knackered all the time with no energy. So
Yeah,
it really does drain your energy supply. So for me, that's where the drinking the aloe comes in
yeah.
because it gives me more energy, and
Gives you
that's
more energy.
kind of what
Exactly.
I felt more than, it's so draining having endometriosis. It really drains
Mm,
all of your reserves. So that definitely is where I found the benefit.
we
I'm
found
going
the
to show you
benefit.
something. The girl who doesn't want to go to sleep is now asleep on the carpet. So I'm going to jump off in a minute and put her in bed.
All right, no worries. Thank you for coming.
That's all right. Thank you.
Thank you.
Jackie, in the
I'm not
chat,
looking at the chat.
Fiona has
Oh,
said,
lots
thanks,
in there.
very informative. Did you try any teas with red clover, lemon balm, raspberry leaf, passiflora, and maybe
Oh,
see a herbalist or naturopath?
yeah, such a good question. Um, Raspberry leaf, I used to drink a lot of, and then I discovered that it can increase your menstrual cramps because my menstrual cramps were bad, and then I stopped. Because I think isn't it used for women when they're maybe going through labor?
Oh,
Is to bring it on. Uh,
yes.
Yeah.
yeah,
So
from
I
37
found that
weeks.
that wasn't necessarily the right thing to be drinking, raspberry leaf. What was the other thing? Red clover. I did take red clover supplements. Not a huge difference, but yeah, some people I've heard, some people have found some benefits. Let me see, what was the message? What was the other things she said?
Raspberry leaf,
I've done the raspberry leaf.
yeah,
Red clover.
lemon balm, passiflora.
So I don't think I tried any of those. Lemon balm, I mean, I just always have lemon anyway, but I didn't try particularly lemon balm. And no, I didn't try the other one.
You had lemon
So, yeah.
balm in your garden.
Yes, but I'm talking about years ago.
All right.
Now I drink it now, but years ago, not necessarily then
And then
when it
did
was
you see a
into.
herbalist or a naturopath?
No, because I was really young. I was in my 20s. I just had no idea what to do. I do remember going up to Covent Garden and looking for people to talk to about it, and maybe going to see one. And a lot of people were saying to me, "Oh, it's so difficult." Because I had fibroids as well, and people saying, "Oh, it's very difficult to manage, very difficult." I felt really lost, and all I knew is that I had to take control and do something myself. So
Wow.
now these days, I know it's so much easier because there's so much choice out there, and you can look things up yourself. But at that time, I was managing more or less by myself, I think. And then over the years, you start to realize that there are other people out there might have alternative ways. But it was also really expensive, really expensive. It's not as accessible as it is today. So I am talking 30, 40 years ago, 35 years ago or so. Yeah.
Mm.
Anyone else?
Well, I'd like to welcome T, who's come in since we welcomed everybody. And there's not just Mrs. Comfort, there's somebody else on iPhone.
Yeah,
I'd like to welcome you here.
and then there's a number as well. Somebody with a very long number.
That's
No.
Fiona. She
Oh,
introduced herself in the chat.
cool,
That's
fantastic.
Fiona. She's Aisa's guest.
All right. Hello, Fiona.
And
Hello, T.
she's made a lot of questions in the
Nice. Well, thank you, everyone. Thank you for coming. Oh, it's 20 past. Gosh, okay. No audio. Okay, right. Thank you anyway. Thank you for coming. Hi, T.
T.
Thank you so much for coming. I hope you found it helpful and informative. If you've got any questions later, please contact me or anyone else that's invited you this evening. And
or tap the questions in the Health Junkies.
yes, put the chunk. Yeah,
Because
that would be a
any
good idea.
question you have or any comment you have is helpful to other people.
People
So
too.
we love it if you add it into the Health Junkies, and then Jackie can answer it there, or Dr. Janeth, and it gives the answer to everybody. So no question is too silly. We would love to hear them all in the general Health Junkies chat.
Perfect. Thank you.
Fiona, talk to Aisa. She can add you into the Health Junkies. It's a WhatsApp group.
Thank you and good night.
Good night.
Good night.
Good night, Mrs.
Good
Comfort.
night.
Good night.
Nice to see you, Winifred.
Bye.
Thank you. Thanks, everyone. Bye.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye. Right. Leave.
Hi, Jackie. Call me later.
Oh, yes, I'll call you later. Okay, bye.
Thanks very much. Bye.
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 Thank you, ladies. Bye. Take care.
See you tomorrow, Aisa.
Yeah, see ya. Bye.
Oh, everyone's gone now. That's it.
Jackie, that was very good.
Thank you. Thank you. Thank you. Thank you for your help.
Are
Thank
you are still recording, Jackie?
Oh,